Hi, and welcome back to Sex School with the Student Wellness Center. My name is Margaret, and today we're going to be talking about contraceptives that prevent against pregnancy. So all of these methods do need to be prescribed and or inserted by a medical provider. So these are not things that you can go and just pick up at the grocery store, but they are excellent against preventing against pregnancy. However, they do not prevent against STIs or HIV/AIDS transmission. So the first one that I'll be showing you today is probably one that you're most familiar with. It is the birth control pill. It'll come in a pack similar to this. You'll get a month's worth at one time. And what you have to do is take one of these pills at the same time every day. So you will take all of the pills, and then you can start your placebo week, which means that there are not hormones in these pills, which does allow you to have your period. If you'd like to skip your period, it is perfectly normal to not take the placebo week and to just move on to the next pack of pills. The way these work is they are hormonal. They are different combinations of estrogen and progesterone, which work together at the levels in the pills to prevent against pregnancy in different ways. So a doctor can definitely help you decide which method and which type of pill would be best for your body. The next method is also a hormonal method, but instead of taken orally, it is actually inserted vaginally. It is called the Nuva Ring. This blue part here is simply for demonstration. The ring itself is just this plastic squishy part right here. And what you do with this ring is you insert it once a month to prevent against pregnancy, and then you can remove it for a week to have your period, or you can simply remove it and insert a new one to ensure that pregnancy prevention continues. So again, this is also a hormonal method, but instead of being taken orally, it is simply inserted into the vagina. Another method is also hormonal, but it is a long-term contraceptive method, which means that it can be inserted and left in for years at a time, and is a great way to ensure continuous pregnancy prevention. That is called the implant. The implant is this little piece of green plastic that you can see right here. It's about the size of a matchstick. It's inserted by a medical provider into the forearm. In this demonstration model, you can see we've got what would be kind of just a demonstration forearm, and you can actually feel the implant under your skin. So it's a great method for somebody that would like to make sure that they can ensure themselves that the method is still there. This is inserted by a medical provider and can be worn for a number of years. If you decide that you would like to become pregnant, all you have to do is schedule an appointment to get it removed, and then you can get pregnant as soon as the device is removed. Another type of long-acting contraceptive method is called the IUD. The IUD stands for intrauterine device. This demonstration model here is used to represent a uterus. So the IUD can either be hormonal or non-hormonal. The non-hormonal kind is made out of copper, and that is going to be the longest acting type of contraceptive. You can leave that in for up to 10 years. There are also different hormonal brands of the IUD that can be worn for different numbers of years. It is inserted by a medical provider through the cervix, and then it sits comfortably on the inside of the uterus, and when inserted properly, you can't feel that it is there. It has some plastic strings that hang out of the bottom of the cervix, and these are very, very thin, and they tend to curl up at the top of the vagina right up against the cervix, so they can't be felt during sexual intercourse. And again, if you do decide that you'd like to become pregnant, all that you have to do is schedule an appointment with your medical provider to get it removed. And then it does not affect fertility, and you can again get pregnant as soon as you have it removed. So all of these methods are again, wonderful at preventing pregnancy, but do not prevent against the spread of sexually transmitted infections or HIV/AIDS. If you have questions about what type of birth control method would be appropriate for you, we have information available at the Student Wellness Center that explains these different types of methods and more. And you can also always schedule an appointment with a medical provider to talk about your options as well.